We are just getting started and situated. We are going to have everyone on mute while we are waiting for a couple more people to join us, and we will get started momentarily.
I'm good.
While we're waiting for a few more people to arrive, I just want to welcome everybody who may be watching on the NASW New Jersey Facebook page. We are live simulcasting this Zoom press event on the NASW New Jersey Facebook page. So please feel free to watch it there, and it will be archived there for future reference. Just go to Facebook and search /NASWNJ, and we'll get started in just another moment or two. Again, welcome to our Facebook community. For those watching on Facebook, you're joining a live simulcast of our press conference on the mental health crisis in New Jersey and the inability of social workers to obtain licensure in an expedient fashion. We're going to be getting started in just a moment. And if you need to navigate away from Facebook, you will be able to find this video archived on our Facebook page, Facebook /NASWNJ. It looks like we've got a number of participants online, so let's get underway, and thank you all for joining us today. My name is Jeff Feldman. I am the Director of Advocacy and Communications for the New Jersey chapter of the National Association of Social Workers, and I am joined today by some esteemed colleagues who are going to share with you some information about the struggles that social workers have had obtaining licensure through the state of New Jersey during the past year plus, and also the impact that that is having on provider agencies and consumers here in the state of New Jersey. We're going to be hearing from a few people today. I'll introduce them one at a time as they speak. I'm not sure if there are any press on the call at the moment, but we will have time for Q&A at the end of this session. And of course, we're also available for comment. Following this meeting, we will share phone numbers and email addresses as appropriate at the end. So to begin today, I would like to introduce Jennifer Thompson, MSW. She is the Executive Director at NASW New Jersey. And Jen, please feel free to start your remarks.
Thank you, Jeff, and thank you everyone for joining us today. The National Association of Social Workers New Jersey chapter is the largest professional association of social workers in New Jersey. We represent the voices of over 20,000 licensed social workers, members and non-members across the state, and the hundreds of thousands of community members that they serve on a daily basis. Social workers are in every community, every town, every institution, every hospital, organization, school, serving the people of New Jersey on a daily basis. Social workers are also the largest provider of mental health services in our country. In this moment of history, amidst a global pandemic and a racial and social injustices that we face, social workers have really risen to address the imperative needs of our community. They responded swiftly, they responded selflessly, without pause, without reservation, and they have worked tirelessly to support you, constituents, me, our children, our loved ones throughout these turbulent times. But unfortunately today, the system that oversees social workers, the New Jersey State Board of Social Work Examiners and the Division of Consumer Affairs, is failing not only social workers, but the communities that they serve as well. For over 19 months, the Board of Social Work Examiners has fallen short of its obligations to process social work applications in any reasonable timeframe. Potential licensees have waited upwards of 19 months, often longer, foregoing job opportunities while waiting for the board to process their license. To add insult to injury, the phones are going unanswered, emails are not responded to, and potential licensees are not able to check the status of their application and even tell potential agencies when they can expect to be in the office, providing critical services in the communities that you and I live in. From an agency's perspective, this has led to constituents in our communities waiting somewhat times up to 3 months to receive critical mental health services that they need. While the licensing board sits on these applications, not responding to calls or emails, they are quite literally holding the fate and health of our communities in their unmonitored inboxes. Today, the licensing board met for its regularly scheduled meeting where over 160 individuals took time out of their work to share their personal stories with the board. They pleaded with the responses to applications. They asked for acknowledgement of their plight. They asked for phone calls to be answered. They asked for emails to be responded to. They also selflessly volunteered to help the licensing board and the Division of Consumer Affairs address these issues just to help resolve the problem. For nearly 3 hours, social workers took to the microphone to share that they have been offered jobs, but were passed over due to the licensing board delays. They shared that they are looking to be licensed in other states, some even sharing that they're considering leaving the field in its entirety to move to a profession where the licensing systems move more efficiently. Agencies also shared that the dire impact to their services due to the board and the Division of Consumer Affairs failure to move on applications. They just cannot meet the needs of the community that they're dedicated to serving. Now today, there was an acknowledgement that there was a problem, right? Which is the first step in the right direction, but that really is just the first step. So today we stand on behalf of the social work community and the clients and constituents they serve and ask for our legislators to demand answers. We ask that the Office of the Attorney General inquire as to what barriers and systemic breakdowns have occurred that allowed for this complete disaster of licensure to emerge. We also ask that Governor Murphy meet with us, the National Association of Social Workers, and hear really firsthand what the experiences are, why social workers are not able to meet the critical needs of the state of New Jersey, and to work collaboratively with us and other essential stakeholders to appoint diverse board members, to create systems that are functional, and to fix the system that's broken. Social workers are on the front line of our communities, certainly during the pandemic, but on a daily basis as well, responding with the urgency that the community demands of us. It's time for the New Jersey Licensing Board, the Division of Consumer Affairs, and Governor Murphy to rise to address this crisis with the same sense of urgency that social workers possess when responding to the community needs. Thank you. I'll turn it back over to you, Jeff.
Thank you so much, Jennifer, for those eloquent remarks, really well stated. I'd like to now introduce Dr. Don Apgar, LCSW, Licensed Clinical Social Worker. She is the director of the Undergraduate Social Work Program at Seton Hall University and a national expert on social work licensure who has previously chaired the New Jersey Board of Social Work Examiners. Dawn, welcome, and thank you for being here today.
Thanks so much, Jeff. I have to correct one thing. I'm a licensed social worker, so I want to. I don't want to misrepresent myself as, but thank you very much. So I am a licensee. I've been a licensee and been involved with licensure in New Jersey since its inception, working on the original licensure laws. I also have the pleasure of working with licensing boards all over the country. So I have a slightly different perspective. I want to just start by thanking Jennifer, you, Jeff, and the rest of the NASW staff and the organization, because I think this is a longstanding problem. And I know you've worked very diligently over the last year, trying to go through appropriate channels, work with senior staff at the division. And I really honestly don't think we would even have the acknowledgement of the problem or be able to mobilize in the way if you hadn't really taken hold of this important issue. So thank you. I was at the meeting and I think I was never prouder to be a social worker because we heard so eloquently from our students. I'm an educator both on the undergraduate level, and at Seton Hall we have a graduate program as well, right? And we train our social workers to advocate for others, but often we don't advocate for ourselves. And so I think I'm shocked that it's gotten to this point. And it's really been a problem that most legislators, I think, and most people didn't know about. So I was heartened today to have some acknowledgement of the problem, but I really view this as, right, the devil is in the details, and it's really a time for action. The good news is that there's a lot of other states who have best practices and are not experiencing the kinds of backlogs or inefficiencies or problems that we are. So there are a lot of models out there that we may be able to adopt. One of the major problems has really been that unlike other processes where you have a specific, you'll hear back in 24, 48, 2 business days, there hasn't been any accountability. Our new graduates, our people entering the field have just been told to email, not knowing if they're going to hear in 3 months, right? A year. We heard from people today who have been waiting more than a year to have their licensure applications processed. There are call centers for other state pensions, other parts of state government. It's really unconscionable that an applicant can't get someone on the phone, that their only means of communication is to go to a public meeting, right? You know, and speak at a public session about these plights. I do want to frame this issue a little differently. We heard from a lot of graduates who are basically saying they can't get jobs. And there's, I think, important data. The average MSW graduates with $66,000 in student debt, 49,000 of which is specifically from their MSW program. And I'm happy to provide this, Jeff, the data source and the report if needed. This is current data. And nationally, the mean salary for an MSW is $47,100. So you don't have to do the math to figure out, right? These are people who are waiting for jobs to earn $47,000 a year, right? With debt in excess of 60,000, right? So I have personally talked to social workers who are struggling. They're living in poverty because they can't get the positions, and we're going to hear, you know, in a bit from employers and not able to fulfill the mission of social work, right? And to do the work that the reason that they went into this profession. But I also think it's important to talk about the fact that social workers, people entering the profession, are predominantly women and disproportionately people of color. So there's data that shows that about half of social workers, right, are people of color. And we also have data that many people who are entering the profession now are first gen. They're entering the first individuals to graduate from college. And so we're talking, many people go into social work practice because they've been helped by a social worker, because they have experienced adversity. And so they're the helpers, right? That's what our profession is about. But I don't think people really understand the severity, right, of denying someone a license or delaying their license 3 months or a year. This really is not only affecting the individuals who have worked hard for these degrees, and we heard people who took pride in that, but also their families. So I'm hopeful that we're going to move forward. The call center sounds like, potentially a first step, but there are lots of first steps. And Jennifer, I was thrilled to hear that you're calling for the governor and perhaps even an independent entity to work directly with the division, a task force or some sort of ombudsman or something to really take a look at this issue, because the problems are multifaceted. It's not just getting a call center. We've heard get the online application, that'll solve it, right? Do this. We've heard these sort of quick fixes, and this is a problem that is going to take some time to fix, but one that I know that if we work together, we can fix. And so the great thing is that we have fantastic educational programs in New Jersey. We have some of the top social work programs in the country. We're turning out and educating a fantastic workforce. So our collective goal is to get these students out into the job so that they can make a difference and help those in need.
Thank you so much, Dawn, for that perspective. And again, just want to call out how fortunate we are here in New Jersey to have you in our social work community representing at the Seton Hall program, and for all the work that you've done historically. I mean, you truly are one of the preeminent experts in social work licensing and exam taking in this country. So thank you for making the time to be with us here today. And now I'd like to ask Shauna Moses to provide her comment. Shauna is Vice President of Public Affairs and Member Services for the New Jersey Association of Mental Health and Addiction Agencies. Shauna, please go ahead and provide your comment.
Thank you, Jeff. I think many of you might be familiar with NJAMA, a lot easier way to say the long name of our association, but real quickly, we are a trade association representing providers of mental health care, substance use disorders, intellectual and developmental disability services, and they provide the full gamut, not only clinical, but also support service such as housing, employment, education, the whole continuum. And today's meeting this morning and this event now is another example of how impressive and how inspiring and dedicated all providers are. So I'm going to go to my prepared comments now, and I'm going to elaborate on that. Thank you very much. For years, the behavioral healthcare system has been contending with staff shortages and a constantly increasing demand for these vital services, which has risen exponentially as a result of COVID-19, and it's expected to continue. Behavioral health professionals, social workers, and many others need to receive their licenses in a timely manner in order to meet the current and future needs of all New Jersey residents. Social workers and other behavioral healthcare providers constantly demonstrate passionate dedication and resourcefulness. For example, as shown by their quick transition to an expansion of telehealth services during the pandemic. And they have a profound positive impact on everybody they are able to serve. Mental health care not only enables individuals to manage and potentially overcome symptoms such as depression and anxiety, but it also empowers individuals to strive toward other goals such as employment and education. The longer it takes to resolve this licensing backlog issue, the more potential negative impacts will be experienced by social workers and other providers, in particular, the stress and anxiety they've experienced as they await their licenses, or that they are experiencing rather, and the individuals who need their support. If treatment is not readily available, individuals will be at risk of experiencing worsening health conditions and possibly risk of suicide. Over the years, behavioral health care providers have faced numerous challenges in fulfilling their personal mission to help individuals struggling with mental illnesses and substance use, which is commonly associated with mental health issues. The licensing backlog, as well as delays in applicants being able to take their exams for licensure, is yet another obstacle that must be resolved, especially as the need for services is continually increasing. Many social workers eloquently expressed their determination and dedication, as well as their frustration, during the Board of Social Work Examiners meeting this morning. Several have mentioned they have lost job opportunities. Others fear losing their jobs as they wait for their licenses. And still others stated that they consider leaving the state or the field altogether, some before they even have the opportunity to enter the field as they had recently graduated. Meanwhile, behavioral healthcare agencies are extremely eager to hire more clinical staff and frustrated by their inability to hire enough qualified employees. We cannot afford to lose any more social workers or other behavioral health care providers. This is a vital field that needs to be strengthened for the benefit of individuals throughout New Jersey. This situation is causing much anxiety for social workers and undoubtedly will lead to exacerbated symptoms in individuals whose services are either interrupted or delayed as the professionals who want to serve them are not able to do so. We greatly appreciate that the Division of Consumer Affairs and Board of Social Work Examiners are working to reform the system, and we look forward to hearing of progress made about licenses being awarded, and as a result, the much needed enhancements for behavioral healthcare providers, the system, and especially the youth and adults throughout New Jersey who rely on it. Thank you so much.
Thank you very much, Shauna. Got stuck there on mute for a second. Thanks again for your comment, Shauna, and thank you to Najama for stepping up today and helping to support this valuable cause. You all at Najama are amazing advocates for the agencies you represent and fierce advocates for consumers and mental health care here in New Jersey. And we really appreciate you joining us today.
Thank you very much.
You're welcome, Shauna. I'd like to share a little bit of information that we've received from some legislators. We reached out to a number of legislative leaders over the past week to help raise awareness of this issue and to garner their support in bringing systemic change to the Board of Social Work Examiners and the Division of Consumer Affairs. And I have a statement I'd like to read on behalf of Assemblyman Paul Moriarty, who is the chair of the Assembly Consumer Affairs Committee. He wishes that he would be able to be with us today, but unfortunately had a conflict he could not move. And as such, he's provided this statement. The delays in granting social work licenses throughout the pandemic are unacceptable. Countless applicants for licensure have had to endure delays of several months at a time when their services are needed more than ever. The delays in granting licenses not only affect the income of the workers involved, but also the many people who could have been served by each worker. My office has been contacted by multiple constituents having issues with their licensure application. These constituents are not able to contact the Board of Social Work Examiners as their calls and emails have gone unanswered. We must find a way to accelerate the approval process and allow people to get to work. I have spoken with the Office of the Attorney General to make sure they are aware of these unprecedented delays and to demand a resolution of these issues as soon as possible. Again, that was a statement prepared by Assemblyman Paul Moriarty, chair of the Assembly Consumer Affairs Committee, who could not be with us today. We've also received support from a number of other legislators who were unable to join us for today's press conference. Assemblywoman Joanne Downey, chair of the Human Services Committee, has offered her support and has submitted a letter to the Attorney General's office asking for a quick resolution to this issue. We also received supports from a number of legislators who were either present at this morning's Board of Social Work Examiners meeting or who sent a senior staff member to attend. I'd like to specifically call out and thank Senator Paul Sarlo, Senator Joseph Vitale, Assemblyman Herb Conaway, Assemblywoman Carol Murphy, and Assemblyman Thomas Giblin, all of whom were present at today's meeting and with either spoke up and provided comments or were there to gather information to find a way to help resolve this issue. I also want to take a moment to just acknowledge and thank all of those individuals who came to provide public testimony this morning at the Board of Social Work Examiners meeting. I believe, as Jennifer noted at the onset of this call, there were over 160 social workers, educators, legislators, and other advocates who were there to try to raise awareness for this issue at the meeting, including 60 who provided public comment, and a number I couldn't keep track of that was going by so fast of people who presented written comments to the board as well. And I would just like to take a quick second to share anonymously a couple of the sentiments that were shared by those who were in attendance at the meeting today. One applicant who has been waiting since February for an update on the status of her application says she feels like you have to be lucky to get a license, and that she has friends who have received licenses very quickly and others who have been waiting months and months and months. And she feels like it's just a random lottery that is amounted to professional neglect. Another applicant who has been waiting since February of this year without a response has said that this is actually the hardest thing she's had to deal with professionally in her career so far. Doesn't make a lot of sense that in a career as difficult as social work, that obtaining licensure is the biggest professional challenge. We also heard from an applicant who indicated that employers that she knows are getting frustrated and impatient because they are waiting for licensure status updates from their employees, and they are not able to provide them because there's no timeline or communication of when a license can be expected to be granted. She notes that the issue has existed since prior to COVID, and she wants to get out and help her community recover from the pandemic and isn't able to because she's stuck in this bureaucratic backlog. She finds the situation physically and emotionally draining. Another applicant specifically said he's looking for licensure as a social worker so that he can provide services to underserved communities, specifically the LGBTQ+ community and adolescents who are struggling right now with many, many different causes and things, from the pandemic to homophobia, to racism. There's just so many issues that are impacting these young folks. And as we know, suicidality among children and teens is on the increase according to recent reports, and even higher among the LGBTQ population. He's indicated that he's really frustrated and just wants to be able to help this community and is unable to do so. We heard from another applicant who indicated that what's happening now is creating anxiety in an industry that tries to decrease the anxiety of others. And it's presenting a real challenge for people to be able to practice the work that they're able to do without the license that they have, while trying to manage their own anxiety around this issue. She notes that it's unconscionable and disrespectful that she's unable to serve the people that she has so diligently strived to help. She thinks that there's something wrong in the system and really would like it to be fixed before her daughter, who just graduated with her MSW, has to go through the same difficulties that she has. Lastly, I believe, as Jennifer noted, a couple of individuals, a handful, noted that they would be willing to come in and volunteer their time with the board just to help remove this licensing backlog, which is a generous offer and shouldn't be necessary. And as another applicant noted, she thinks that it's ludicrous that applicants should be having to volunteer their services in order to help process the licenses that are under backlog. That's just a small sampling of the comments that were provided today. And as we wrap up, again, I want to thank the folks that spoke today, those of you who have signed in to listen into this press conference. And if there are any press on the call, or if anybody has any questions, we'd be happy to answer some of those now for the next few minutes.
Thank you, Jeff. I'll just add, thank you, Don and Shauna, for joining us today and for joining us at the meeting this morning. We will be following up with an official press release that will come out momentarily after this press conference. And we look forward to answering any of your questions as well. But certainly thank you for joining us and to lending your voices to this critical matter.
If you have questions, it's a small group online, so you could just unmute and speak up if you'd like to question or comment.
Hi, I have a question.
Yes, go ahead, April.
Like, I called in and inquired about my license. I actually signed up May 8th, and I did speak to someone, but she directed me to an email address, socialwork DCA or something or sort. So I emailed it, and I continue to get this automated response saying that she's working diligently to answer all emails, but all emails will not be answered. How do you go about resolving that issue?
So it's a great question, April, and it's one that unfortunately a lot of people are experiencing. What I'm going to ask you to do is, if in the chat box for this call, if you wouldn't mind sharing your email address, we will follow up with you. The board at today's meeting provided a comment form that people with questions could submit into their registry so that they would be able to directly follow up with all those people. So I want to make sure that you have that information, but I also want to connect you with the staff in our office who handle licensing, just so that we fully understand your issue and can help you move this along in any way possible.
Thank you very much. I appreciate that.
You're welcome, April. Thanks for your comment.
You're welcome.
Nancy submitted a question in the comments. What is the process of issuing a license number once the application is approved? Unfortunately, since I'm not part of the administrative organization at the BSWE, I can't really answer what the process is for receiving a license or for receiving a number. I don't know if anybody else on the call has insight into that, but I think, Nancy, the best thing would probably be just to leave us your email as well, so that we can make sure you have the contact for the board and that somebody from our office can follow up with you.
Yep, I will also say Christina Mina, who's our Director of Member Services, has put her email in the chat box. So if you have questions, you're certainly able to connect with Christina at NASW. And April and Nancy, you've got really great questions, and they definitely deserve answers. I think that's why we are here, why we're elevating, you know, the work and trying to really shed light to the fact that there are a lot of questions about the process in and of itself, but also the lack of responsiveness and inability for us to connect and get our questions answered. That's why we're here today. So we look forward to helping you to the best of our ability, but a lot of those answers unfortunately do reside within the licensing board itself and the Division of Consumer Affairs.
Thank you.
Again, I wanted to just say, I think over, you know, this is NASW has sort of become the call center for the state. And so I know the staff you reported handled 200 calls last month alone. So you know, that's very nice. And it's very nice for social workers to say they would volunteer. I can't imagine any other healthcare profession would volunteer to go in and process applications. I'm actually not a fan of volunteering. Social workers are professionals. They are educated, and they pay fees to have their licenses processed in a timely manner and appropriately. So to me, it's nice that we're willing to fill in the gap, and I think we wouldn't be where we were, right? People wouldn't be licensed at all, probably without the help of NASW and their efforts. But it's time that somebody can reach someone by phone. There's many people, I think we can all sympathize that we've been working at home. We have phones that, as in some ways, the pandemic has made communication easier. But it just defies that there is no phone. There is no ability for someone to speak to someone. All we do is send emails and fill out forms. That's just not acceptable.
And I would echo that. And I think you're absolutely right. And, you know, the height of the pandemic, we all moved very quickly and swiftly to online communications. We figured out the Zoom. We've learned how to do conferences and use voice over internet. And the first few months, I think it was possible for us to give one another grace and to really understand that we're all in a period of transitioning, but we are well into 19 months. And as many people did note on today's call, that inefficiencies, but also the lack of communication predates the COVID-19 pandemic. And so these are longstanding issues that reside within the Board of Social Work Examiners, reside within the Division of Consumer Affairs. And it really is time for the entities to do the basic functions that they're responsible for doing. And it is unconscionable that social workers would have to volunteer to process their own licenses just so they could get a job. And I love that about our profession, but also it is time for us to put the responsibility where it needs to reside, and the accountability is paramount. It is time for the agency and the division to do the work that licensees pay them to do, and in good faith, they have taken their money, and it is time for them to process the applications in a timely manner.
Yeah, thank you all. As we wrap up, I just want to point out that Jennifer and I have both placed our email addresses in the chat box if you need them. And Christina Mina, our Director of Membership, who handles a lot of our licensing issues, her email is in there as well. And you can always reach us at our main office number, 732-296-8070. Leave a message. If no one picks up your call, and somebody will get back to you within 24 hours or quicker. We can promise that. And then I just want to say, as far as follow-up steps, I know that those of you who are invested and have licenses and applications pending that are on this call are anxious for movement. We will be, as Jennifer said, issuing a press release summarizing some of these issues a little bit later today. We're also going to be issuing a communication to our broader membership and our email list, updating them on the issues. And then expect that soon you will be hearing from us. We're going to be reaching out to the governor's office. We're going to be reaching out to Speaker Coughlin and Senate President Sweeney and looking to sit down and have discussions with them and their staff about actions that can be taken to address this issue. And again, we'll also be working with legislators to address this issue through the Attorney General's office as well. So we hear you, we support you, and we are moving forward aggressively on the issue. Any final remarks before we wrap up?
I would just want to say one thing. We've really, worked hard for a strong licensure law in New Jersey, and licensure is about consumer protection. I'm very proud of the licensing laws that we've put in place. I'm very proud of the work that's been done here in New Jersey. But what I don't think people realize is, because our protections are so strong, which they should be, we're working with the most vulnerable people. That really means that someone literally cannot work without a license in New Jersey. And that's not the case in other states. In other states, there are more exemptions and provisional licensure. In New York, there's other things. In New Jersey, we don't have that. And so, every day that an application is not processed, or someone's question is not answered, is a day that they're not working and they're not providing service. And so I think we're honestly at a critical point. And if we can't fix the system, we're going to be jeopardizing those consumer protections, which we fought very hard for.
Yeah, thank you so much. Well said.
Dawn, I appreciate that comment too, because when the person or persons aren't able to work, they're neglecting their family as well. It's just not the families they're serving, it's the family that they're trying to care for themselves. So this is really important. It's causing a lot of anxiety within the person who's presenting to test, which can cause them to fail. It's a lot at hand with this. You practice, and then, time comes, you're so nervous because of what happened. You're so nervous because if you fail, you cannot work. It's a lot that goes on with this.
Yeah, thank you so much, April. And also just wanted to point out, if you didn't see it in the chat box, Christina Mina sent you her email address and asked you to email her directly so she can follow up with you. I
did. Thank you, Christina. Thank you all.
Yeah, thank you, April. All right, thank you everybody for being here today. I think we've used enough time at this point, but thank you all the speakers. Thank you for everybody who's on this call listening in. Again, if there's any press on the call, you're welcome to follow up with us afterwards via phone or email. We're anxious to speak with you, and stay tuned for more updates on this issue. Have a great day, everybody.